Somapet is one of the first graduates of a new midwifery training program in the Laos People's Democratic Republic. From her base in a rural health centre, she serves a dozen surrounding villages. The last time Nang Lao got pregnant, she nearly bled to death after she had her baby at home without medical support. On a visit to her home, Somapet conducts a prenatal exam and advises Nang Lao to go to a health centre when she's ready to give birth.
The midwife told me I should take care of myself and eat well, so I will have enough blood when the baby comes. If I feel the baby is coming and I cannot get to the health centre, she said I should contact her.
Before Somapet was trained, there was no one with proper birth attendance skills serving Nang Lao's village. Worldwide, every year, 350,000 mothers and millions of infants die from complications related to pregnancy and childbirth. Most of these deaths could be prevented with more skilled birth attendants and better access to emergency care. Laos, a poor mountainous Southeast Asian country with a severe shortage of skilled medical staff, has pledged to improve maternal and infant care as a commitment to the UN Secretary-General's global strategy on women's and children's health. Closing the personnel gap is the first priority. With support from the UN Population Fund and donors, Laos recently established training materials and licensing standards for a new cadre of community midwives. 140 students, mostly auxiliary nurses, enrolled in the midwifery course at the end of 2009. The course aimed to make students proficient in managing normal pregnancies and childbirth, and to identify, manage and refer cases with complications. Trainees honed their skills by delivering babies at a nearby hospital under their teacher's guidance. A potentially life-threatening complication occurs in about 1 in 7 deliveries. Women giving birth need a skilled attendant who knows how to respond to obstructed labour, hemorrhage, shock and infection, and there needs to be an accessible referral facility. Before her training, Somapet lacked the skills to save mothers and newborns in complicated situations.
I knew something before I took the course, but my knowledge was not very clear. For example, I didn't know the danger sign. Now I can recognize a dangerous situation, and I can tell whether I will be able to cope with it or not.
Since Somapet returned from the training, there has been a steady increase in clients coming to her health centre. Besides pre- and postnatal care, she provides family planning advice and child immunisations. Reaching women in distant villages remains a challenge, but reports from local health volunteers help health centres keep track of pregnancies throughout their areas, and the midwives make house calls when they can. Ta, aged 23, is pregnant for the 3rd time. Her first baby, delivered at home with no help, was stillborn. She suffered a late miscarriage in her next pregnancy. This time, Ta is glad her local health centre has a newly trained midwife.
I lost 2 babies, and it was very sad because it takes a long time to carry the baby, and you expect to see the baby's face. It took me a long time to recover. This time, I want to keep the baby. I don't want to lose him or her again. Anytime a problem happens, if I feel anything strange, I quickly go to see midwife.
Laos has a long way to go to ensure that all women can give birth in safe surroundings. But the country's new midwives are an important start.